The new 97.9 Light FM KODM, we've got a special guest in the studio today to talk about breast cancer awareness and screening. Dr. Wempe's back in.
Hey, thanks for having me.
It's good to see you again.
Nice to see you, too.
With Midland Memorial Hospital.
Absolutely. Allison Women's Imaging.
And you guys do such a great job of making sure the community has information. And today we're going to be talking about women and their screening for mammography and getting that done, right?
Absolutely. Yeah, that's what we're here to do. We're here to encourage people to get the yearly screening mammogram, because what we want to do is we want to find cancers when they're small. If we're able to do that, we stand a pretty good chance of a successful treatment and cure.
Right. But that means that people have to get screened. They have to get in. What's our average here in West Texas as opposed to the national average?
Well, I'm glad you asked that question. A few years ago, we pulled some of our internal data, and we found that we were just under 30%. Now, the national average for women 40 and older to get their yearly screening mammogram is around 50%. And in the state of Texas, it's at 53%. Wow. So we're quite a bit lower than those numbers.
Why do you think that is? I mean, busy lifestyle. I mean, there's a lot of stuff going on, whether that's, you're taking your kids to sports or whatever. Right. Is that part of it, or is it just, knowing that you can do that or you need to do that? It's a multifactorial problem. There's a lot of misinformation out there. There's a lot of fear. Gosh, do I have cancer or do I not have cancer? And quite frankly, we as physicians need to do a better job about promoting breast cancer awareness and getting patients to come in and feel safe about coming in and finding out, most of the time there's nothing. Right. But what we want to do is find things early. Sure. Mm-hmm. And you guys make that process pretty easy. Can you run through basically the process of how someone who would want to get screened can do so?
Well, just find a telephone and pick up your telephone and dial 682 X-ray 9729. You do not need an order, but you do need a physician for us to send the letter to. Right. But it's that easy. It takes about 20 minutes, and it's a small sacrifice for a study that may save your life.
Right. It doesn't take very long.
No, 20 minutes, and you're in and out the door.
Fantastic. So if you want to get maybe a family member, maybe it's a husband that says, my wife hasn't had a mammogram in a while, how would he approach her? Would he just say, hey, this is something we really need to do? Because I know guys, we're horrible about this.
Right.
Wives go get your prostate exam. Really? No. And it's tough for us to pull out of that mode. How do we get the women we love in our life into that mode that they go and get screened?
Well, it's interesting that you say that, because the driver of healthcare is typically the wife or the mother, and so that's an interesting question that you ask. I think the most important thing is that you get a little information and you say, this is something that, God forbid, you're diagnosed. It's not a death sentence, but we need to find it early, and just tell them that you love them and you care for them, and have them pick up the phone and schedule their mammogram.
Okay. Well, let's look at a possible scenario. So they go and they have the screening and they find something. Mm-hmm. There's something that shows up. What's the next step?
That's something we've worked very hard at. We are an ACR Breast Center of Excellence. That's imaging-based metrics, an NQMBC certified Breast Center of Excellence, one of only 4 in the state of Texas. And so we have a comprehensive breast center team. So myself and the patient navigator, who's a breast cancer survivor, we sit down with the patient and we discuss options before the biopsy. And then once the biopsy's done, if it is positive, we have a whole team, including a fellowship trained breast surgeon, a reconstructive surgeon, oncologist, pathologist. We're a team, so it's an integrated care model. That's a big difference.
Right.
So patients can stay in their own community, be treated here. In a time of uncertainty, they have a driveway that they recognize. They have a grocery store that they recognize. That's a big thing. That's a big deal.
You bet. Having that support system locally, having something familiar, you bet. Mm-hmm. We've been talking with Dr. Wempe with Midland Memorial Hospital about breast cancer screening, how it's important and why it's important. Let's go ahead and talk about, again, how can people get in touch with you? How can they find out more?
Well, you can go to Midland Memorial's website and look under mammography. We have multiple programs, outreach programs. In fact, we have a lecture yesterday with the Midland Junior League. We have a luncheon today with the Midland Hispanic Chamber of Commerce. And so what we're trying to do is we are trying to reach out to the community and let them know that we're available, and let them know a little bit more about breast cancer and its prevention. Again, you can just, if you want to schedule your screening mammogram, it's 682 X-ray. Very easy to do. And we encourage people to do that.
Thank you, Dr. Wempe, for
Thank
coming
you
out.
so much. I appreciate
Again,
it.
get it done. Ladies, don't put it off. Let's go ahead and increase that average here in West Texas and go get screened for this month. It's National Breast Cancer Awareness Month for October. For those of you who might have missed this interview, you know friends that would benefit from this interview, we will have it posted on our website at kodm.com.